And to Health Matters now, a Nigerian scientist has urged the government to employ the services of grassroots influencers to increase advocacy and awareness among rural communities to control vaccine hesitancy. Now, this follows reports by the WHO on the resurgence of COVID-19 in Nigeria's Benue state, which has since been debunked by the Nigeria Center for Disease Control and Prevention. News Central's Adesewa Odusoga gives us more.
Following the reported resurgence of COVID-19 in Nigeria, the World Health Organization has issued a warning against a possible outbreak. The body called for increased vaccination and testing after the announcement of 25 fresh cases in Benue State, north-central Nigeria. Although the Nigeria Center for Disease Control and Prevention denied the resurgence, stating clearly that such reports were a misrepresentation of the WHO statement. Dr. Oladipo Kolawole, a biomedical scientist who spoke with News Central, cited possible reasons for a resurgence, which include climate change and reduced testing.
Climate also has a role to play. Climate change has a role to play in infectious diseases. And there are seasons, last time it came up is around December 2019, things like that. So with cold is also coming. For you to know the particular strain that is circulating, we need to go further in the testing by sequencing. After sequencing it, we do some bioinformatics analysis. Then we can now say that this is the strain that is circulating, because strains are region dependent.
As of February 2023, just 30.5% of Nigerians had received or recommended vaccinations against COVID-19 since the country's vaccination program began. Given its low rate and 211 million populace, Nigeria failed to meet the World Health Organization's aim of 70% immunization coverage by the end of June 2022. This low vaccination rate can be directly linked to vaccine hesitancy that the country has dealt with since its inception.
We need to get people that are closer to the grassroots to talk about it, not people that are far away from the grassroots. In my community, if you bring somebody from Lagos, they hardly trust the person because they have not been living with the person, they don't know the person. So when we make policy, we need to carry people of, let me say, grassroots influencers, not just ordinary influencers, but grassroots influencers. Now, assuming that the woman selling the market, they have a child that has a little bit of influence and is educated, and is living in the community. So if he is talking to other group of his mother in that community, they tend to listen and they tend to trust him because he grew up in that community. And not only growing up in the community, he's still living in the community.
The federal government through NCDC has included COVID-19 as a priority infectious disease in the Integrated Disease Surveillance Strategy. What this means is that routine COVID-19 testing and reporting of the disease along with other infectious diseases are now required following the official declaration from the WHO that COVID-19 is no longer a public health emergency of international concern. Adesewa Odusoga reporting for News Central.